our consumers and as well as testing and how all of that data falls along. And so what makes him the expert, not only because he's the chancellor at our research medical institution, but also during the COVID-19, the contributions of LSU Health Shreveport has been the creation of an emerging virus threat testing lab. They call it the EVT. And also the creation of a serology testing lab critical to optimizing convalescent plasma therapy success and a return to work pathway. And if I mispronounce or misstate anything, I know he will correct me, and I encourage it. And also, let's see, what else have we done? Creation of a lab producing 3D nasal swabs, which are critical to expanding COVID testing due to national swab shortage, and delivery of the first convalescent plasma therapy to a critically ill COVID-19 patient, and delivery of the first inhaled nitric oxide therapy in Louisiana and the second in the US following Harvard. So we are so excited to have today our Chancellor from LSU Health Shreveport, Dr. Ghali, join us. And so Dr. Ghali, I'm going to give you the floor. Our participants are continuing to dial in, and we have several, but with anticipation of what the governor is going to tell us when we can reopen, give us some guidance from the healthcare side of things.
Sure. Lisa, thank you for having me on today. Y'all may want to mute your side because I hear a lot of echo in there. If y'all could just mute yours.
I believe everyone's muted.
Okay, great. Again, I want to thank you guys for inviting me today. I want to thank the Bossier Chamber for inviting me. I always enjoy my time with you guys, whether it's here locally or whether it's in DC at the Mardi Gras. You guys throw a great party. Yes, number one, I don't want to get ahead of the governor today, and I will not do that. But I will share some of the thoughts that he has and that I have. First and foremost, I want to let you guys know I'm not an economist. I think, as a dentist and as a physician and as a surgeon and as chancellor of this health science center, I know a little bit about economy, but I'm not an economist. I like to think that our health science center is one of the biggest economic engines in this community in North Louisiana, and we're very, very proud of that and proud of the support that we get from the Bossier Chamber. I think that, there's four things that I really want to hit on. I mean, I can go over the numbers today, but you guys could just as easily pull that up on the Department of Health website. And the numbers are getting better as far as what we're seeing. But really, there's four areas I want to just mention. One is the data and the science. And number two is the flattening of the curve. And number three is what I like to call, it is what it is.
Right.
And number four is the word evolution and the evolving process. And I want to thank you. I was taking some notes here as you were saying. So you had a pretty good grasp of what all's been going on in the past couple of months here, and we're very, very proud of that. But let's talk about the data and the science, and really all the decisions that's driving the governor is based on data and science. It doesn't mean that we have all the data and science that we need, because we don't. That's why testing is so important, so we can get those numbers. So I don't want anyone to think that anyone definitively has 100% right answer on this disease process. It's a novel virus. It's a novel coronavirus. And this virus more than likely made the jump from bats to an animal to humans. There's some debate about whether it was created in some lab and it got out that way through a human vector. But again, that's all up for debate. What's really important to look at from a data and science standpoint is that we're getting more data and more science day by day. Let me give you an example. just in the last week here in the Health Science Center, we've been able to determine, because we have very sensitive and specific testing. Our testing is not a commercial test. Our test has been created by true research virologists. And we were very, very lucky because Dr. O'Callahan here years ago, 30 years ago, established a very robust virology department, which was funded by the National Institute of Health. So we have one of the top virology departments in the country. Our virology department, when, I remember I got back from the Philippines, and about 2 weeks after I got back from the Philippines, all this stuff started hitting about what's going on in Wuhan and everything in China. In a matter of a short period of time, they were able to, because they had some previous experience dealing with the SARS virus, they were able to create a very sensitive and specific test, what they call a reverse transcriptase polymerase chain reaction, or an RT-PCR test, to test for this COVID-19 virus. And not only does it test for the virus with a high sensitivity and specificity, but it also tests for various strains of the virus and the virus's ability to mutate. Now, 2 weeks ago, we didn't really have a good grasp on what was the actual strain of the virus up in North Louisiana. But the strain in North Louisiana is very similar to the strain in South Louisiana, which tells us that it got up here more than likely one of two ways, because the strain that we have in North Louisiana is a more of a European / French / Spain version of this virus, compared to the virus on the West Coast, which is more of a true Chinese variation of the virus. So whether people from the South that either went down for Mardi Gras or whatever brought the virus back with them, or people from the South came up here and brought the virus, or whether someone who traveled to Europe and came back before the president restricted travel, that's where that virus came from. One of those 2 or 3 sources, either from the South up here, by somebody coming up here, somebody up here going down there, bringing it up here, or somebody traveled from Europe and brought it here back to the North Louisiana area. Regardless, that is an idea where science is now driving us, because we see that this strain that we have up here is different than the strain that they have in California, that may be in part that it seems to be a very virulent strain, and that may be playing into the factor of, in addition to the comorbidity factors that we have in Louisiana, that may be playing into why it's so virulent and so it's caused so much death in the great state of Louisiana. So that's, when I talk about data and science, I'm not talking about we have all of it. I say that we're getting more understanding of this virus. And I want to give accolades to our virology group here, headed by Dr. Kevel and Dr. Urachko and Dr. Sapp. Number 2, I want to just mention flattening of the curve. And you hear that all the time. And the flattening of the curve doesn't mean that there's going to be overall less cases. It just means that those cases are going to be distributed over a wider period of time, so it doesn't overwhelm the healthcare system. We were very fortunate in North Louisiana because we don't have the same population density that South Louisiana has, or New York City, or New Jersey, or some of these larger towns. So what's happened in this situation is the flattening of the curve is the direct result of the social mitigation factors that people have done, the hand washing, the staying 6 feet apart, the wearing a face mask, the stay-at-home order. All those have resulted in flattening of that curve. Now, until more testing is done, we can't know unequivocally where we are going. So more testing is really necessary. And again, the key is to get the testing to where, if you were to do a random sample of 100 people, no more than 10 of those people should be positive. And that's going to tell us that we've got a pretty good sample. If we're sampling 100 people and 50 of them are positive, That's just telling us that we're pretty much focusing on only the symptomatic patients, which so far has been what the guidelines of the CDC is. So when we're looking at really ultimately flattening the curve, which we've done a pretty good job at, but again, it's not like we have a cure right now. It's not even like we have a great treatment right now. So all this is based upon the physical distancing or social distancing, the meticulous hand washing, the stay at home, the fact that the kids have been home for this period of time. So that's really what's caused the ultimate flattening of the curve. Now, I mentioned it is what it is, and really what does it is what it is mean? Well, we're going to have to accept a new normal, and the new normal is very similar to the new normal we saw after 9/11. And everybody was freaked out about it in the beginning. I can remember when I was fairly, not too young, but I mean a teenager, I could fly on an airplane, I could give my ticket to somebody else, and the other person on the other end could fly back on my ticket.
Right.
They didn't even check your driver's license. They didn't check anything, you know. And then we started before 9/11 having metal detectors. And then after that, it became even more draconian as a result of the terrorist attacks. So a similar thing is going to happen here. You know, we're going to have to be conscious of how close we necessarily sit together in a restaurant. Maybe the hostess and the waitress and the people that are working in the kitchen are going to need to wear masks. You know, maybe we have to wear masks. And maybe we have to limit the number of people that sit at a table. These are all measures that are similar to 9/11 and what happened in the airline industry. But I don't think you can ever eliminate terrorism. And that's my personal opinion. We always have to be cautious about it. And then I don't think I would ever advocate taking a metal detector out of the airports. But by the same token, you could just as easily have somebody that works in the airline, you know, loading the bags that could be a terrorist. So there has to be measures that are put into place. But unlike the airline industry, I do believe, as an optimistic individual, that ultimately there will be a vaccine for this. And ultimately, we won't have to continue to do any of the. Well, I mean, look, we should always wash our hands, right? I don't know how many, I don't know about girls, but I know when I go into a men's restroom, you know, it's important to wash your hands before and after you use the restroom, not just after you use the restroom. But, you would be surprised, probably you wouldn't be surprised, how many people don't wash their hands after they go to the restroom. You know, they'll come out of the stall and they'll just walk out of the bathroom. Now, God forbid if they work in that restaurant that I'm in or whatever, but you know that is the reality. So some of the stuff that's been instituted nationally and here statewide needs to stick forever. Good hygiene during flu season. There's no reason to hug people and to shake their hands because that's the way these bugs are transmitted. These viruses are transmitted. But it doesn't mean that when it's not flu season and once we have a vaccine for this, that people can't hug each other, that people can't hold hands, that people can't shake hands. But right now, it's a little bit risky time to do that. So it is what it is, and it's going to get better. And then just remember that none of us are really experts on this. It doesn't matter whether it's Dr. Fauci or anybody else. Everybody is going on what is their gut instinct and what is in the best interest of people. We all want the economy to open up. We also don't want any more people dying. But this is an evolving process. Just like when they first came out and said, it's really not necessary to wear a face mask. Now it's necessary to wear a face mask. And I expect this to be an evolving process. So please remember the importance of the fact that this is an evolving process and a recommendation that we make today may not be necessarily what we do a month from now. And so when people are critical of what the president or what the governor does or says, they're basing it on what their best information is at that time, at that given time. And then if it needs to be modified, then it'll be modified. I do want to mention our EVT lab that Lisa mentioned. This is the Emerging Viral Threat Lab. I hope to make that ultimately into a center of excellence for our Health Science Center for North Louisiana. It's one of the very few in the entire country. We're very fortunate on this campus. We have a BSL-3 lab here, which is a biosafety hazard level 3 lab, which basically can take care of any pathogen other than Ebola, basically. And it's because of that lab that they were able to create this test. And now we have also created an in-house antibody test. You've heard about some of the antibody tests, and you've read about some of the inconsistencies in those tests. Some of them are not very specific. They're sensitive to coronavirus, but they're not necessarily very specific to which coronavirus it is. So someone could have a common cold, and it could cross-react in that test, and it could give you a false. The fact that it's a false positive. In other words, it's falsely positively showing that they have antibodies. So you tell that individual, wow, you're good enough to go forward and go back to work, and you can get exposed, or you can go and see grandma, or you can go see grandpa, or you can go back to your work in a nursing home. For most of us, it's not going to be, even if they're negative or positive, if we get it, we'll be fine. But it's that vulnerable population, and then the immunosuppressed population. So that we are now testing, and we did receive a grant from the Caddo Commission. We began testing this past weekend at the MLK area in the David Raines Clinic, tested nearly 200 folks. There were some positives in that generally asymptomatic population, and so we're keeping track of that. We've tested a couple of nursing homes in this region. Not going to name which ones they are. They had a significant positive population there, so that's a real containment issue, and we're working very closely with Alex Bu in the Office of Public Health to help try to get that contained and to do contact tracing on those folks. We're very fortunate to have smart people here on campus, and we have a 3D printer, and I've purchased 2 additional 3D printers, and we're printing our own swabs. That's been the rate limiting factor in testing nationwide is the swabs. Currently, we can print over 350 swabs a day, and we're going to be able to go to 1,000 a day, hopefully in the next week or two. And we're also concomitantly working on a valid saliva test, so that we don't have to do the swabbing. Someone can just expectorate into the little tube, and then that specimen can then be tested for virus, obviously not for antibody. The antibody test is a serum test, a blood test. You see some places are doing it with a little vial like you do a pinprick. That's really not as good as actually drawing the blood and doing it that way. Lisa's right, we were the first place in the state and probably the third in the country to do the convalescent plasma therapy on 2 patients so far that are critically ill patients. And we also were the first in this region, and it's a collaborative between ourselves, Harvard School of Medicine, and the University of Alabama in Birmingham, using inhaled nitric oxide, not nitrous oxide like laughing gas. I know you would like that. And it's given in an inhaled form, almost like you would a vaporizer, and that improves the blood supply, the oxygenation of the blood supply to the lungs, where the virus has a predilection for, and it also the nitric oxide also apparently has a virucidal effect, where it actually on contact has a propensity to kill the virus, which is a good thing. So we also have 12 additional trials going on right now, specific to COVID-19, looking at various drugs from various drugs, and we're very careful here. As you can see, one day hydroxychloroquine is okay to be done, and then now the FDA has come out just in the last few days and said it is not going to approve it at all for any outpatient studies. because because of the cardiac side effects that you can get, particularly if hydroxychloroquine is combined with a Z-Pak. Both of those can cause QT prolongation and can cause malignant arrhythmias in the patient and sudden cardiac death. So we have to be very careful with those agents. Now it's only approved for in the hospital therapy while the patient is meticulously monitored. So anyway, Bossier's done a great job in testing. They've done about 5,000 tests, but still I think we need to do more, obviously. So I don't want to keep rambling on. If there's any questions or comments, again, I'm not an economist. All I know is that it's important to get everybody back to work as soon as possible. But there are some positive things that we can, that can be gleaned from this disease process. And I think it's going to make us stronger as a community, stronger as a people. I've seen a lot of good things in this community happen. Just today we moved our women and children from our campus here on Kings Highway to a new campus that we have at the old Shreveport facility, now called. We moved 25 or so patients over there today, a combination of infants in the NICU, PICU, and women that have recently delivered or about to deliver. So far, there's been 2 children delivered there today already.
Wow.
And so, we're up and going. That's going to revitalize the whole Highland neighborhood, I believe. And it's a good thing for Shreveport Bossier all together. I saw lots of people come together. I saw the National Guard, many of whom are members that live in Bossier Parish and Caddo Parish and all of North Louisiana. I saw the state police. I saw the Shreveport Fire Department, the Shreveport Police Department, the Caddo Homeland Security, Office of Homeland Security. I want to thank the governor for helping getting all that coordinated, and it was a really good effort between Ochsner LSU Health System and the LSU Health Sciences Center.
Well, Dr. Ghali, we are just so honored to have you and the medical school here in our community and in our region. I think if nothing else, this time has reminded us of the folks on the front line in the healthcare industry and in the research labs and all that we take for granted that are here every day for the future of our public health safety. And so the information that you have given us is just great, and I congratulate you, and we say thank you, and thank you for being a leader in our community and working with the other healthcare hospitals and everyone else to make sure that we do have a safe community. As a reminder to those that are joining us, if you are calling in and did not join us via video chat and you have a question for Dr. Ghali, if you would email that to jessica@bossierchamber.com, and she will ask the question. And if you are with us on the video and you are able to get to the chat box, if you'll type it in there, and we will address those questions as well. Knowing, Dr. Ghali, I'm going to kind of start it off while those are coming in, knowing that the governor is getting ready to make an announcement, and I know you don't want to get ahead of it, but prior to us getting on this call, I was listening to Governor Abbott in Texas, and it was like, oh, I was really surprised at everything that he was opening up, and pleasantly surprised, but also with reservation when he says opening up malls and retails at a 25% occupancy and things of this nature. And I know you don't want to get ahead of the governor, but are you in constant contact with the governor's office? Have they been communicating with you for advice regarding Northwest Louisiana and such?
Sure. The governor has a lot of capable people around him for sure. And he's a very, very smart, measured guy, and he is incredibly talented in being able to take information and come up with his own decision. And he's looked over the majority of the weekend and all this morning, met with the people in the Department of Health, looked over the data, and is going to give a recommendation here in about half an hour or so that I think everybody will be pleased with. I don't think it's going to necessarily be as open as what Governor Abbott is talking about. Of course, they didn't really have the same impact that we did in Texas, and
Right.
it's a much larger state. So, you know, and they also, if you look at the, you know, hopefully Governor Abbott's right. I know Governor Abbott is a great guy, he's a smart guy, but they also have a larger capacity to take care of certain issues over there related to healthcare. I mean, they have, you know, a lot more major cities with each one having, you know, half a dozen large medical centers in them. We don't really have that luxury in Louisiana, so we have to be more careful and a bit more measured in this. And I think that ultimately, when we get more testing out there, I think we'll have a little bit better of an idea and a little more flexibility in what's going on. But you're right, I'm not going to get out ahead of the governor.
Well, I mean, wise decision, but we would honor it up here. We would allow you to, and we would never tell. All nearly 70 people on the call, we would never tell.
Yeah,
but
you'd have to come visit me in Angola, I'm sure.
So let me, so you talked about the testing, and actually at the beginning of your comments, it was the first that I had ever heard that there were multiple strains or different strains of this virus. And that was a very interesting facts, and that we have this specific strain that is, you know, equal to what's happening in New Orleans, but not in California. So as you address that a little bit further and you talk about more testing is necessary, can you also address as to where are we now with the testing, and when do you think we'll have adequate testing, and how this relates to all of the business folks that are on the call is them, based upon what the governor tells us, is will they be required like to do temperatures or the PPEs and all of that kind of good stuff, or if we can get the testing where it's at, then we don't have to do that. It's very confusing for all of us.
Yeah, those are all good questions. Those are all good questions, Lisa. And I will tell you that a couple things. One, we have hard facts on, and one, we don't have so hard facts on. The one that we don't have so hard facts on is, you know, when do you wear a mask? You know, when do you not wear a mask? You know, what's going on with all that? You know, and it's always, you know, it's probably more true if you wear a mask that it's really protecting others more than it's really protecting you. So, you know, when do I wear a mask? I wear a mask. You don't see me wearing a mask in here. Of course, I'm the only one in this large conference room right here.
Right.
But, you know, if I was going to get out and get anywhere where I thought I was going to get less than 2 arm lengths next to somebody, I'm going to wear a mask. If I'm going to go in an area where there's a high potential of folks that are sick, like the hospital, I'm going to wear a mask. So we mandate everybody that goes in the hospital wears a surgical mask. Let's talk about a business. Okay, I have 4,000 employees here right now just in the health science center side, not counting the hospital. The 4,000 employees right now, since the stay-at-home order is as we sit here effective until the end of April, I have a huge number of those folks that are working from home. Okay, the ones that are coming in here have to wear a mask. Now, it doesn't have to be a surgical mask. It can be a cloth mask, a homemade mask. It could be a scarf that they put over their face when they come in. But once they get to their desk, if they're fairly isolated, they don't have to wear their mask during that period of time. If they're going to get up and go to the restroom or go out somewhere else, then that's going to be a possibility. They're definitely going to have to wear their mask. If I'm at home and I'm going to go and go to the mailbox, I'm not going to put on a mask. If I'm at home with my family, who I'm with all the time, I'm not going to necessarily wear a mask in that case. If I had someone that's immunosuppressed in that environment, I would probably wear a mask to protect them.
Sure.
If I'm going out to walk the dog, I'm not going to wear a mask. Okay, so then the other part of your question was, testing. Again, right now as we sit here, we've done about 140, I'm sorry, a little under 150,000 tests.
Wow.
In Louisiana. That's
Yes,
a combination of state lab and commercially performed tests. If you divide that by the total number of cases reported, which are 27,068 as of noon today, the positivity rate is 18%. I told you before, it's got to be 10% or less based on epidemiologic studies. Good epidemiologic studies are going to say you should not have more than 10%. The lower the number, the more people you're testing, and that'll give you a better idea of what you're really looking at. So we need to do more testing so that our testing is down to at least a minimum of 10%. Now, there may be a certain, Bossier Parish may be great at it, and they may be at a 5% testing, but Shreveport may be at a 20% testing. So that needs to be adjusted, right? Because if there's no invisible border between Shreveport and Bossier, that's going to prevent somebody. A lot of people that work in Shreveport live in Bossier.
That's correct.
And vice versa. So we have to do random testing across the board in order to do that. So I don't think enough testing has been done clearly, because we're still sitting at 18% positivity rate right now. That's mainly because we've been mainly testing symptomatic people. When we start testing more asymptomatic people, we'll be able to find that those asymptomatic people are also going to be positive as well. So we have to continue to test more folks. When the antibody testing comes in, that's going to be even more important. Now, what am I doing here? I'm going to ultimately end up testing all 4,000 of our people that are up here. But we're doing it in phases based on what those individuals, the ones that work in the hospital, they're going to get tested first. And then, phase 2 are going to be the research folks that may be in a lab and not necessarily exposed as much to other folks. And then finally, it's going to be those that are currently at the stay-at-home, the non-essential, the secretarial, the clerical. When we ultimately bring those in, then I'm going to test those folks as well. So it's going to be kind of a stepwise pattern.
We appreciate that, and we know that we're all in an unknown territory and learning as we go along. Based upon what the governor announces today, and then I would assume that there would be an additional release if the data is correct, opening up a little more in 2 weeks, and then another 2 weeks. It seems to be that's the trend of the other states. We have on the calls with us today a variety of industries, but the industries that are asking the most questions are those of the spas, the salons, and the gyms. And, when are they going to get to open? I know you can't answer that, but when that day comes, what kind of recommendations as our research institution and healthcare provider what kind of recommendations would you have for them? And then can you give us the information about the importance of gloves? Because I had somebody call me today at the chamber and said, I can't find gloves. And I'm like, I'm not an expert, but I think it's really, you just need to wash your hands before and after. The mask is more important than the gloves, but I don't know. Can you help us with that?
Certainly the mask is more important than the gloves. And the reason is that you can wash your hands. Now, sometimes the advantage of the gloves are, when you're wearing gloves, you're less likely to touch your face because it kind of feels gross, to touch your face or pick your nose with wearing a glove, So the real issue is, when you open up a place like a beauty salon or a barbershop or whatever, those are all important businesses. The biggest complaint around here of all the doctors is, God, I need to get a haircut, man. I mean, I'm dying I'll pay $100 for a haircut. I'm thinking $100 for a haircut. Yeah, that's how bad off, people are. It's a very important industry, Plus, these folks are our friends, the restaurants and the barbershops and everything else. So I do think that at least between now and the time that a vaccine comes out, that it's the responsibility of the patron as well as the owner of that business to inquire as to whether that individual is sick or not. You know, are they sick? If they're sick, then you don't need to be cutting their hair. It would be safer if you wore a mask. You know, obviously you can't go to the dentist and wear a mask. You know, the dentist wears a mask, but you can't wear a mask, right? So, but you know, you need to be conscious of that. You need to be conscious of how many people you have in your waiting area. You know, but you're definitely right. I am having a temperature check on every single person that comes into the hospital and that comes into the medical school right now. We've limited access, you know, like, you know, is that possible to do in a mall where you want to check everybody's temperature? Well, I will tell you, when I was in the Philippines, it's at the very beginning of the incident in Wuhan, or maybe a month after it started, I could not go into a mall or into the hotel without getting my temperature checked. And then nobody minds, you know, I mean, I want to know if someone's got 102-degree temperature. I don't want them in the hotel. I don't want them, you know, changing my bed sheets and sneezing on my bed sheets, you know, and then me hopping in the beds, you know. So these are things that can be instituted, and they're very similar to going through the metal detector, you know, at the airport. Although I do believe that with the vaccine, hopefully in 6 months, no later than 18 months, that we won't have to continue to do that kind of stuff. That we'll be more prepared in the future for this type of incident. But you're right. Washing the hands is much more important than wearing the gloves. Of course, you know, you can wash your hands, but you don't want to, you know, stick your fingers in your eyes or your nose or in your mouth, because that's really the only way it can get into your body. Can't get into your body through the skin. You can only get in primarily through the mouth and nose, and secondarily through your eyes.
Okay, well, thank you. Well, we have some questions that have come through. I'm going to toss it over to Jessica, who's the Vice President of the Bossier Chamber of Commerce, and she's going to go through some of the questions that have come through. So, Jessica?
Yes, we have, sorry for the feedback. We have 3 questions so far. So, obviously they all semi-relate, but we will ask each one individually. So, first, we have a question: if an asymptomatic person or people don't have any comorbidities, should they feel comfortable moving about the community at will?
If an asymptomatic person has no comorbidities, should they feel comfortable moving around the community at will?
Right.
Right. Well, there's 2 components to that. Okay. One component is if that individual is asymptomatic and he is negative for COVID virus, and they don't know that because they didn't get tested, right? If let's just say that they're asymptomatic and they don't have COVID, okay, then if they just move about, they could catch it from somebody else and not, you know what I mean? If they just do it without any kind of protection at all. So that means that for me and for my recommendations is during this period of time, you know, I will tell you that if I were a betting man, we're going to respike a little bit sometime in between September, October time period. I do believe that the warmer weather, this is a virus that doesn't like warm weather, and it doesn't like that at all. And so it's probably going to become dormant for a while, but then it's going to come back as we relax things, and we just have to deal with it because it is a seasonal virus is what the epidemiologists are saying. Now, the other component of that question is you could be the asymptomatic person and you're COVID positive, and you're just moving about the area, and you go see grandma or great grandma, and you didn't know you had COVID. She catches it, and she's in the hospital. Or you go and visit her in a nursing home. She catches it, and so do several others in that nursing home catch it. So I would say the fact that you're healthy and you're asymptomatic doesn't mean that you're not positive right now. There's no way to know unless you get tested. And if the importance of testing is, it will help tell you that. Now, another thing you could do is you could get antibody testing. And that antibody testing will tell you whether you have antibodies to the virus, which then means that you're less likely to catch that virus again, and I say again because if you have antibodies, you had to have got it, but you were probably asymptomatic as a result of it. But if you have antibodies, then that might protect you. And I say might protect you because you have to make sure that qualitatively those antibodies are good. That's why our antibody tests here that we've developed and that we're going to be able to do probably 1,500 of them a day here shortly. We're getting a FDA EUA, which is Emergency Use Authorization from the Food and Drug Administration. It'll be the only fifth test in the United States approved by the FDA for in-house viral antibody testing. So the advantage of testing the antibodies is it tells you if you have them, and you'll be more protective, and then the chance of you getting it, it protects you, and then probably that means that you won't get it and will be less likely to transfer it to grandma or grandpa or great-grandpa or some immunosuppressed individual.
That's what I was going to ask as a follow-up. If you have the antibodies, does that not mean you could still be a carrier?
That's a possibility. That's a possibility, but it's less likely.
Okay. I'm going to
less likely.
Skip down to a question that seems to relate kind of straight to that. Is the challenge for business owners is that they're being told, you could test today and be negative, but maybe tomorrow you would be positive because of the incubation period for the virus. So how will we address that concern?
Yeah. Well, and that's a valid concern from the business folks, and that's why here on this campus, what I'm doing is I'm doing viral testing every 2 weeks. It's not perfect, maybe doing it, because you could test somebody today on Monday, and then they could get it that later that day or the next day. The test you did on Monday would be negative, and then ultimately they would be positive. And you would not know it. But at least if we test it every 2 weeks, that gives a pretty good range. No one wants to get tested every day or every week. We've decided somewhere between 10 and 14-day testing is a good way to do it. And this is something that we may have to do for the next 4 to 6 months until we come up with an adequate vaccine for this. Now, those individuals that have developed antibodies, and we test them, and their antibodies are very specific, and they bind to the receptor on the virus, and we can test that in the lab, then those individuals probably don't need to be retested.
One question was, as we're seeing more people out and about, but without masks on, do you feel that poses a greater threat to the health of everyone?
Yes.
And so a follow-up question to that is, if we have people wearing masks in our business, how do you equate a safe occupancy level? And so is that with the recommendations that maybe the governor's coming, like with groups of 10 or the 6 feet?
Yeah, that's going to be in the governor's recommendations that are coming up.
Okay. Another question was, when will antibody tests be more available to the general public? Someone's saying they were told they are not available to them now, but like they're expecting a grandchild in a few weeks and they'd like to be able to know kind of where they sit so they could visit.
Yeah, well, that's a good question, and it is available, but again, the antibody testing that is being done at most of the hospitals is only being in clinics is only being given in situations where the patient is symptomatic. Okay, so I think that the antibody test is only a couple $100. I'm not charging our students and our residents here for doing the test here. We're doing our own test for it. But I will tell you that it's becoming much more available. But I would be careful because, as I mentioned, the sensitivity, the specificity of that test isn't necessarily very good of the commercially available ones. Some of them have a 50% error rate. So you're telling somebody that they're positive and they have antibodies, and then they think that they're safe to go out, and in reality they're not. So I think it's important I think the better tests are coming out and they're becoming more available. I will tell you that our hope is to make it more available to everybody in the community. You know, we have been doing some in the nursing homes in this area because they have such a problem. Not because they're bad, but just because it's easy for a caretaker to come in, and then all of a sudden everybody in that whole nursing home gets infected. I believe that the antibody testing is really the way to go. The only thing that's better than that right now is going to be getting a vaccine produced quickly. The key about the antibody testing is knowing where, you know, how to get it and everything else. Now, the key is that, you know, if I had a business, and again, I'm not an economist or anything, but if I had a business of a reasonable number of people, 100 people, 200 people, 500 people, something like that, I would not be opposed to, if I own that business, to partner up with a reference lab, for example. And this is not an advertisement for our lab, but I'm just saying, which our lab is now considered, ours a CDC, FDA, CMS approved a reference lab, and say, you know, I'm going to pay to test, you know, my 100 people, you know, or whatever. In the long term, that's probably going to save you money, and it's going to, you know, be safer for your employees. Now, you never know once your employee leaves there if they're going to go get exposed somewhere else. That's the conundrum in this whole thing, is that there's so many asymptomatic spreaders that you can't it makes contact tracing difficult. If you had a disease process where 80% of the people got sick and 20% didn't get sick, and you could contain it pretty easily. But when it's just the opposite, when 80% don't get sick but have the virus and 20% get sick, it's hard to contain those suckers, you know, because they get around and get all over the place, and you don't know it. And so that's the conundrum with this thing.
So, using your words, to contain these suckers, this virus, is that it really is an individual responsibility, which you talked about that. And we need to be following the guidelines of the CDC and our healthcare providers when we're out in public, and continue to do so until a vaccine comes about.
Yes, ma'am. And I think the more of that we do, the better that we'll see the numbers continue to drop. And then ultimately, you know, right now, based on the numbers that we have, we don't have enough folks that have what's called herd immunity, where a large group of the people are immune to it, so that when that virus attaches onto somebody, it just dies off because it's got no place to go. It's kind of like a Pac-Man machine that's ended up in a dead end. It got nowhere to go, and that's the way the virus is. And then all of a sudden, it just fizzles out. We don't have enough people that have that immunity, and the ultimate immunity by doing that is through a vaccine, not through general herd immunity.
Well, thank you for addressing that, because I was like, oh, you're opening up a whole new can of worms there. There are a lot of folks out there that are like, just let it be and we'll work through it till we all get our immunity. But that is not the proper way to do that. A vaccine is the proper way to do that.
Yes, ma'am.
So, okay, well, our time is coming up so that we can all get ready to go hear the governor. And Dr. Ghali, I just, again, want to say thank you to you and your leadership and your research team and the LSU Health Shreveport and what you again mean to our region. And yes, you're doing this chamber chat with the Bossier Chamber, but 38% of our members are in Shreveport. We represent the Twin City community, and you already know, those on the call may not realize, but you know, whenever we go down and advocate for businesses at the state legislature, our number one priority has and continues to be LSU Health Science Center, because we know how critical it is to maintain this facility in our area, and we are so grateful and thankful to have you here. And you know, after we hear the governor's announcement here and he gives us those guidelines, we may call you back to say, okay, now that we know, since we're not getting ahead of the governor, exactly what we're looking at, for possibly this Friday, and then 2 weeks from now and 2 weeks from now, we may come back to you for some additional advice. And thank you for the recommendation of a reference lab. And the chambers, so I'll reach out to Tim and we'll research all of that so that we can get that information out to our chamber membership. And at the last.
Thanks, Lisa. And we love Bossier, and I'll tell you very quickly, we're testing the entire Bossier Fire Department. We started that last week. We trained the Bossier City paramedics, and they're doing the tests, and they're sending them to us, and we're running those tests free of charge for the entire Bossier Fire Department. And if we're able to recoup a little money from FEMA on it, then great. If we're not, that's fine. I don't care. They're really good people. Thank you.
Well, thank you. We appreciate your time. I know you're very, very busy. And so again, thank you to everyone that is on the chat. And after we hear the announcement today, our next get together virtually will be Wednesday at 2:00 for our virtual networking. And we can discuss after the governor's announcement at our virtual networking at 2, share ideas on what that means for each other and how are you going to combat it if you're in this industry, how are you going to work it out in this industry, and we'll share ideas. So everyone, have a great day. Tune in online to on the governor's Facebook page, and you also can go to the Louisiana Public Broadcasting channel to hear the governor's announcement. I know we're all eagerly anticipating and ready to open, but ready to reopen safely and with good health conditions and following the recommendations. So everyone, thank you, and y'all have a great day. Thank you, Dr. Ghali. We appreciate you.